Thank you very much. And today the Executive has had detailed and constructive discussions as we continue to chart our way through this pandemic. I'm going to begin by focusing on the current picture, and we believe that the R rate is currently sitting just below 1. Glad to say that we no longer have the highest level of incidences in the British Isles and now sit below England and Wales. So we have successfully slowed down the rising trend of infection rates, but we still have high numbers of new cases, a further 442 positive cases today, and our hospital admissions and inpatients are still high, and that's a major concern in terms of hospital capacity. There are still 431 COVID inpatients, and when we took the decision on the 13th of October to introduce additional restrictions, that number only sat at 283. So the next 2 weeks are crucial in getting our rates down so that we can all have the safest and the happiest Christmas possible in these exceptional circumstances. So from a minute past midnight tonight, we will begin a short, sharp 2 weeks of extra restrictions. This is different to lockdown in wave 1. Children will still go to school. You can go out to take exercise as often as you like. People can go to places of worship for individual prayer or attend drive-in churches. You can still order takeaway food, and click and collect is available for non-essential retail. But we are asking people to avoid activity which may bring them into contact with others from outside of their own household, and only go out for care or healthcare reasons, for education or for exercise, and work from home unless able to do so. We all now have a real opportunity to get the number of cases reduced to the lowest possible levels. We are urging everyone to do what they can, to stick to the rules and to encourage others to do so as well. And I commend the majority of people here in Northern Ireland for the sensible and pragmatic way that they have supported the public health advice over this difficult year. Since November 14th, when the new COVID fines of up to £1,000 came into force, the police have issued 480 fixed penalty notices, and 460 of those were for partygoers in private homes. With a fine of £200, that's quite an expensive night out, but the true cost, of course, is the risk of infection, of serious illness and possible loss of life. I find it shocking, and I know that the majority of people listening to us tonight think it's shocking as well. Those individuals have let us all down, and it is clear that a united and consistent effort will have the fastest and deepest impact on this deadly virus. We outlined earlier in the week that 3 households could come together for 5 days over the Christmas period, and we will return to that issue after our Executive on Tuesday, when our Chief Medical Officer will bring a paper to the Executive around further specific details. We particularly want to look at those who are clinically vulnerable and care home residents making visits outside of their care home settings. The Executive received a detailed presentation this afternoon from Patricia Donnelly, the head of the COVID-19 vaccination group, on progress with planning for its rollout. Northern Ireland will be in receipt of around 4 million doses of the vaccine, and we will be advised by the Independent Joint Committee on Vaccination and Immunisation. Rollout will be over a number of phases, starting with care home residents and staff, health and social care workers and those aged over 80. And then the at-risk groups, and phases decreasing by age, with the under 50s in the last phase. Mobile teams will target care home residents and staff, and roving teams can support district nursing to reach housebound patients. It is proposed that enhanced trust teams will operate at a number of fixed mass vaccination sites in order to vaccinate all health workers. And the plan is that between 5,000 to 8,000 can be vaccinated per day to ensure that all 100,000 healthcare staff can be covered over a 3-week period. Now, we recognise the logistical challenge of population testing and vaccination programmes on a Northern Ireland-wide basis, so consequently the Deputy First Minister and I have advised colleagues of additional measures we are taking to further integrate and enhance coordination and have connectivity across the Executive. And given the particular responsibilities for the health response and for civil contingencies, we're bringing together in a more formalised structure, a task force, if you will, the Public Health Agency, the Department of Health, our own Executive Office and other relevant agencies to ensure that everyone is working as seamlessly as possible. And we want, of course, to add in additional logistics expertise as well. As well as vaccinations and testing, we're renewing our focus on compliance, our work on economic and societal recovery, and, of course, on communications. So in closing, I want to welcome the sterling efforts individuals are making right across our community. I commend all those who are redoubling their efforts to make our high streets as COVID secure as possible for their reopening on December the 11th. And I want to pay tribute to our scientists, our academics, medics and health workers who are providing us with the pathways out of this pandemic through mass vaccination and testing programmes. I thank all of those frontline staff across our community in hospitals, care homes, schools and in our local community and neighbourhood, and you're making a real difference to the lives and life chances of so many. And to the mums and dads, the children and family friends for supporting the effort and keeping things going. Well done. This is just for a short while longer. It's important to have hope, and it's important that we push a little harder over the course of the next couple of weeks. Michelle.